This is Janice Lopez from the International Organization for Migration, and welcome to the Migration Health Research Podcast. In this edition of the Migration Health Research Bulletin, issue number 16, we feature an article that looks at the effectiveness of pre-entry tuberculosis and post-entry latent tuberculosis screening among new entrant migrants to the United Kingdom. This issue profiles several book chapters outlining the health commitments within the Global Compact for Safe, Orderly, and Regular Migration and Migration Health Governance. Research studies on community-based mental health and psychosocial support in emergencies and psychological morbidity and alcohol use disorder among migrants are also featured. The issue provides information for readers to contribute to an exciting new series on migration health launched by the BMJ, IOM, and MADRI network. For this podcast episode, let's listen to Dr. Dominik Zenner, IOM Regional Thematic Specialist for Health in the European Economic Area, as he speaks about their study assessing the interventions that might lead to a reduction in tuberculosis in high-income countries such as the UK with a low incidence of the disease.
So this study, which is looking at the effectiveness of pre-entry active tuberculosis and post-entry latent tuberculosis screening amongst new entrants or migrants to the UK, is a study which aimed to bring together all the available observational data that we have in the UK to try and understand what prevents active TB. That's the primary outcome. You have to, of course, understand that with all of these programs, so the UK has a pre-entry active TB screening program, which is carried out overseas prior to entry amongst visa applicants, for example, and refugees, but also has a latent tuberculosis screening program, which basically follows up particular persons from very high incidence countries, those with more than 150 per 100,000. And this, of course, costs taxpayers money, it's resource intensive, and it's aimed to decrease the epidemic, the TB epidemiology in the UK, to decrease new cases and to decrease sequelae such as deaths or otherwise. So it's very important to know what works and what doesn't work. And this study is therefore bringing together a number of different data sets in order to find out what are the best preventive measures that we can have. Also in keeping with the WHO and TB strategy, which aims also for a TB elimination in low incidence countries, and the UK is now a low incidence country. So the primary objective of the study is basically to evaluate therefore the effectiveness of these interventions, particularly focused at pre-entry and post-entry latent TB screening, but also looking at other interventions, such as, for example, registration in primary care.
What were the findings from this study that you want to highlight?
Pre-entry screening for active TB and latent TB screening both work, and together they work ever so well. The other key finding that I wanted to point out is that registration with general practice is highly predictive for good outcomes, and early registration with general practice is very predictive for good outcomes. So what we found in this cohort, sadly, is that only about 50% of people that would be eligible, so those that we identified in the pre-entry cohort, actually registered with a GP for a number of reasons, and there may be a number of barriers to register with primary care. And for those that registered with primary care, some of these took a rather long time, which is in itself a very concerning fact, but it allowed us to analyze it as well. And what we can see here is that if you have a late registration with a GP, you're more likely to get TB. Early access to the health system is a very important preventive measure to, in this case, prevent TB, but also probably prevent other illnesses. The other thing that I wanted to quickly point out, and it's not entirely unexpected, is that, of course, the occurrence of tuberculosis cases is related to deprivation. Those people that are least deprived are least likely to get tuberculosis, and vice versa.
What are the implications of this study for a policy or program in the UK specifically or at the global level?
So the first thing I would like to mention, and I start at the end, is that, of course, tuberculosis is a complex disease which depends on many risk factors, and is, of course, back in the olden days, we used to say almost a social disease. If you don't want TB, it is helpful if you earn more money from our analysis. Well, you cannot always do that. Well, one thing you could do is, and we have to work on this, is to register early with primary care. This is key because that's where in a tax-financed health system such as the NHS, a lot of the entry points to the health systems are given. There is a very stark message there because we are fighting for inclusion of migrants, not only visa applicants or refugees, but all types of migrants into a full package of universal healthcare. And this is important because we can see that we're preventing illness and we're preventing disease by doing so. The other thing, of course, is that we know that screening activities work, and we have augmented the evidence in carrying out this study. And it's very reassuring to see that both active and latent TB screening are effective. And in the latent TB screening cohort, there were no incident cases, meaning that the program seems to be highly effective also. So those are sort of the messages. But going back to the key message I wanted to say is that registration in primary care is very, very important for all types of migrants.
Thank you very much, Dr. Dominik, and thank you all for listening. Please feel free to share your feedback with us. See you on the next podcast.